Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. So let's touch on now pain management, because I know this is something that is on the minds of many people when they're going through surgery. So having a pain management plan is really important because we know that with surgery, it is likely associated with some pain, and you can feel stressed or anxious or nervous if you don't have a pain management plan. But if you have a pain management plan, then you know that, okay, I'm going to be okay, I'm going to be taken care of. So it's important to figure out what is the pain management plan for you when you're going for your surgery or for your treatment. So talk to your provider about it, to your medical team about it, and also figure out what is your personal comfort level when it comes to pain management and pain medications and things like that. So you are comfortable with the different options. So now, what are the options? Pain medication can be given in many different ways. Depending on the kind of surgery treatment you're getting, the intensity, it'll obviously vary. But pain medication can be given orally. It can be given as a patch, like pain patches. It can be given as a suppository, which means it could be inserted in. It's given many times as an injection or through a pump, IV. So those are the different ways that pain medication could be given, depending again on the type of pain you're having and the intensity and the length of the pain. So the goal would be to treat the source of the pain and the perception of the pain, and then what the medications are doing is interfering with pain signals. With pain medication, what's very helpful is to know what is the typical onset of your pain. So if the pain comes back every 6 hours or it comes back every 4 hours, then it's good to know that, because you want to take your medication before the onset of the pain. Because when you can do it at the point of prevention, then it's much more effective than instead of if the pain gets worse. So, let's say the pain started and I'm going to be okay, I'm going to be tough. And then the pain gets worse and worse. And then we take medication. In that case, we would need higher dose of medication. And it is all that stress is having an effect on the body. It's putting the body in flight or fight mode and in stress mode, so that is causing further damage for the body. Recognize what your pain pattern is when you're going through surgery, so then you can take medication in advance. Now with pain medication, what I wanted to cover with you is opioids and non-opioids, because there is a lot of questions and concerns around opioids, and we want to try and take non-opioids when possible. So with non-opioids, there are NSAIDs, which is like your morphine, Tylenol, those kind of things. They can be helpful. There are prescription dosages of those as well. You'll want to find out what is the maximum dose that you can take. So make sure you're following that. Many of the antidepressant medications can also serve as pain medications. So that's where, again, your provider may give you some antidepressant medications because they are affecting certain aspects of the body which help with pain relief. Similarly with seizure medications, because again they tend to affect nerves, so it could help with like gabapentin and others. They can help with pain relief that is related to certain types of pain. So know that these different medication options are there, and you may be given one of those. It doesn't mean that the provider is thinking you're depressed or expecting that you would have seizures, but these medications can be effective with pain management. When you're taking NSAIDs, it's important to recognize when to avoid or to be aware about it. So that's why I've listed these points for you with NSAIDs. So if you have aspirin allergy, or you're taking chemo or steroids or blood pressure medications or anything with risk of bleeding or kidney problems, then you'll want to talk to your provider, your medical team, if NSAIDs are right for you or not, or if they may be able to prescribe another medication for you. Now with opioids, opioids are essentially strong pain medications, so they can help with relieving moderate to severe pain. So there are different opioids, opioid type medications. So if you're getting one of these like tramadol or hydrocodone or morphine, fentanyl, like the things in this list here, then those are opioid medications. So important to be aware that you are on opioid medication, nothing to be afraid of. It is a method that is used. It's important to know what and how to manage it. So these medications have certain side effects, and they have a certain level of risk of addiction if they are taken for a long period of time. So that's where you'll want to get a sense of how long you need to take these medication, and what is the wean off time, wean off period for these medications, so that you can be aware and you can accordingly take them when you need them, and then be able to wean off from these medications. With opioid medications, you want to keep these medications locked and away from any misuse, like from children, teenagers, etc. Use the medication exactly as is given by your medical team. They will generally be asking you to do certain urine and blood tests. So those would be expected, I think, from you. Avoiding alcohol and smoking, because that can have interaction with the medication, and figuring out if you're taking any other medication, if there are any drug-drug interaction or drug-herb interaction as well. Do your double check there, or talk to a pharmacist there at your local pharmacy. They can check for you. And of course, don't share medication with anyone else, because you don't know what their health history is. Now, side effects with opioid medication is constipation. That's very common. Some can have nausea, some might have fatigue, some might have confusion. Again, depending on how much medication. If there is a heavy dose of medication, that could result in confusion or hallucination. If it's taken for a very long period, for a long period of time, it could result in risk of addiction. And of course, if it is taken more than the amount that is prescribed and unmonitored, there is risk of overdose. So those are points to keep in mind, and then have a plan for addressing this, especially with constipation. I would say typically with opioids, constipation is very common. So you will want to have a plan for addressing constipation. If natural methods like prunes and other things are working great. If not, then you'd want to take some medications for constipation. Um, and track all these different side effects if you're starting to have them. Now, check if the amount of medication you are being given is sufficient for pain relief, or if you need to increase the dose, or your pain is doing okay and you can reduce the dose, or increase the time between the dosages. So that's something you'll want to keep in mind, keep an eye on it for yourself, because your self-awareness in this can be very helpful in terms of determining whether to step up your dose or step down your dose, so that you can be comfortable. So we covered quite a lot with surgery and pain management. I know that pain management is an important topic, and as it should be, because it affects the quality of our life and how we are feeling. I hope this information is helpful with how you think about your pain management and the different medications that are available. Think about the side effects of these medications, how you can manage them, and know and not to be afraid of doing appropriate pain management. So have that plan to empower yourself to get to that point. Any question as it relates to surgery or pain medication? So can I take NSAIDs if my doctor has given opioids? I think it's important to talk to your provider, to your medical team, and discuss your pain management plan. If they have given you opioids and not NSAIDs, then talk to them about why that is the case. Have they given it for a particular reason, that they're worried about bleeding or some other factor? Or is it that they were thinking that you would have NSAIDs available at home as OTC? So just discuss that with your medical team and let them know your medical history. For in drug-drug interaction or drug-herb interaction, you can talk to your pharmacist, but there are also very good sites that you can look up. I think there is one from Memorial Sloan. There is a drug-drug interaction site, but you can check online. There are sites, I think WebMD and many others have drug interaction sites. So you can put list of your medication and check if there is any drug-to-drug interaction. Also, this is something that you should be able to talk to your pharmacist or to your medical team, that they can check for you. Many EMRs, the electronic medical record, is able to check for drug-drug interaction. So do let your medical team know about all the medications you're getting, but you can also check it yourself. See, question about addiction. So yes, of course, there is risk of addiction that can happen when it is taken long term or it is taken more than the dosages that are given. It's important to figure out that balance of what is the level of pain you're having, and then what kind of medication will work best. Because many times opioids are usually for short term, unless they are for palliative, where it's for pain management long term for that individual. So most of them are short term. So figure out if some non-opioid medication can work. You can talk to your medical team about it. And if not, if they think that opioid is best for you, then find out how long you need to take it. What is the time when you'll be able to start weaning off from the medication? So that way you'll be more comfortable with that plan of action. So if there would be some changes or setup needed in your house or in your car or anything, then those are things you'll want to find out before and have a plan around it. Okay. Also, if they feel that you need that support and you don't have that support at home to be able to do it, there may be option of skilled nursing facility, of a recovery or a rehab center where you would be able to get that support till you recover and are able to take care of yourself and then go home. So those options may be there. Discuss that with your team. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.